Hello and welcome to this West Midlands School of Clinical Hypnotherapy revision video. Today we're going to be talking about the subject of contraindications. Contraindications. These are essentially a reason not to do something. So we get these from the medical world where, for example, a particular drug might be contraindicated by a pre-existent medical condition. So to give you an example, if a patient presented and a doctor was thinking of prescribing them a particular medication for migraine, but it had the effect of heightening the blood pressure, it's an unlikely circumstance, but it might happen. If they already had blood pressure problems, they might look for a different medication because the first one, increasing the blood pressure on an already high blood pressure, would essentially be contraindicated. Okay, so that's where we get the terminology from. However, what does it mean for us as hypnotherapists? What do we consider to be contraindicated? Okay, so in hypnosis, the major contraindication to be aware of is conditions of psychosis. So we could be talking about schizophrenia here, for example. This is where a patient could be argued to be, at least temporarily, out of touch with reality. They may have a distinct neurological or psychological state that they enter. So we really are talking about the extreme disorders here, in which case you would not work with them. Now there is some evidence to suggest actually that hypnotherapy can be quite useful in some of these disorders as a preventative, but that would have to be applied by a specialist with probably with a psychiatric background. So for most hypnotherapists, all psychosis disorders are considered to be contraindications to hypnotherapeutic work. However, in practical terms, the main reason or the main contraindication that most people will encounter as hypnotherapists are contraindications to particular conditions. So for example, the most common of these is probably what I would call a body-focused problem. So these are conditions such as panic attacks, hypochondria, maybe IBS as well, where the patient is likely to be doing a behaviour known as body monitoring, where they're scanning their body for any signs of a problem, any signs of possible anxiety, any signs of a digestive issue, any signs of illness, whatever it may be, and they're scanning the body for that. In those circumstances, we don't want to put their attention onto the body, as a general rule. So we would avoid using hypnosis techniques like progressive relaxation that would actually focus them on the body. Instead, we'd go for something that externalized their attention, that took it away from that. Equally, we might take, for example, with panic attacks again, when it comes to deepeners and using a lot of sort of down and drifting, floating suggestions, because those might be similar to the symptoms the person's experienced for a panic attack, we would again try and use something a little bit more stable, a little bit more grounded for deepening with those people. So generally, it's about responding to the condition in front of you. And a classic example of this is the suggestion limp and slack, which has existed in scripts for sort of 50, 60 years now. A common suggestion, but not necessarily one you'd use with somebody presenting for erectile dysfunction. Okay, so these are contraindications, a reason not to do something. You should always be aware of them, and it might involve changing what you do. It might just involve changing some of the terminology. Be aware of what the contraindications for the condition you're working with are. Thank you very much.